Hi, my name is Casey Lacerda, and I conducted my research on eHealth for the management of chronic pain. Chronic pain is a major burden on the healthcare system in the US. According to the CDC, approximately 20% of adults suffer from chronic pain, and it contributes to an estimated cost burden of $560 billion annually. The etiology of pain is such that it can be difficult to diagnose. It can come from inflammation, it can come from central nervous system changes. There can be chemical reactions in your body that amplify pain beyond what you used to feel. And, these things are difficult to treat. So the easiest way to go about, addressing the problems is often to prescribe opioids. And unfortunately, that has led to another crisis and burden on the healthcare system in the US. So, it's clear that there needs to be an innovative way for people suffering with pain to manage their symptoms. So the use of information and communication technologies for health is eHealth, and it has the potential to help with chronic pain because it can either be used as a supplement to or possibly in replacement of daily, or frequent visits to the doctor. It can also help reach people who have difficult access to doctors or who live in rural areas and are dealing with pain that's otherwise, impossible for them to treat. So the research questions that I went about trying to answer were, how has eHealth been used for the management of chronic pain? What factors influence the effectiveness of eHealth for the management of chronic pain? And how can eHealth applications be improved to support their use for the management of chronic pain? So eHealth comes in a few different varieties. It can be a program administered through your computer or a laptop. It can come through mobile apps on smartphones or tablets, and it can also be telehealth. So the programs that come through either your computer or your phone are a little more involved, and they often will contain instructional videos, reference materials, and even homework assignments that the patient is required to answer before stepping on to the next step in their care. So this information is administered to the patient, and then they are responsible for implementing the therapy, conducting self-assessments and activity tracking, and basically reporting back to the app. So they put that information in the app, and then it gets back to the clinician. Either sometimes it's added to the EHR for their review, which is important for continuity of care. And when the clinician reviews the information from the patient, then they can also get back to the patient and talk to them about their progress. Now, not all programs involve a return of the information to the EHR or even involve clinician response. Some apps are just where patients are expected to maintain them themselves, which can be sometimes challenging. There were several factors that influenced the effectiveness of using eHealth to manage pain, but the most prominent factor was really patient mental health and attitude, because that's linked to motivation and adherence to the program. But what's also interesting is that even in cases where patients didn't experience a reduction in pain, they still sometimes felt that the app was useful to them and made them feel better about their pain. So there's a psychological component to pain that eHealth has really been shown to be successful in implementing. The use of eHealth for pain management did face some challenges, and one of the elements that was really hard to understand was whether or not patients are actually using these apps beyond the study period, because pain or chronic pain is a lifetime condition, and there needs to be some evidence that in order to reduce the cost in the healthcare system, there needs to be some evidence that patients will continue to use these apps and help themselves. So one of the interesting suggestions for improvement were that there could be studies on making the apps a little more engaging to encourage a patient to compete with themselves, to continue to improve, or maybe put a game in the app and just make it more engaging so that they'll continue to use the app in the long term. So lessons learned from the research, the use of different measurement endpoints and varying participant characteristics really made it difficult to measure the effectiveness of eHealth for the management of pain. However, has still been shown that eHealth has the potential to better patient outcomes for people who are suffering, because even if pain wasn't reduced, their mental attitudes toward their pain improved. Lessons learned from class. Before this course, I had very little awareness of the world of health informatics, and it's certainly been an inundation of information. For me, the most interesting component is really the problem with the terminology consistency across the various HIT systems. And those are things that make not only interoperability, but research difficult. And beyond the legal problems of sometimes using EHR for research, there are the problems of interoperability that really need to be addressed. This class also brought to my attention something that's really fun, and that's the world of wearable technologies. And while I've heard of Fitbits and iWatches, there are a lot of technologies that I wasn't aware of, and I'm really interested in taking a look into some of those. So that's it. Thank you for listening, and take care.